Let me start with our today class on macrocytic anemia. This is normal WBC cell neutrophil. This is normal RBC. This one is large, abnormally large red blood cells. This is polymacrocytes বলছিলাম, polymacrocyte or hypersegmented neutrophil. These are the normal segmentation. These are the hypersegmented neutrophil. Macrocytic anemia, megaloblastic marrow, non-megaloblastic marrow. Megaloblastic marrow due to B12 deficiency, folate deficiency, and both folic acid and vitamin B12 deficiency or other inherited disorders. Non-megaloblastic alcohol, hemolysis, liver disease, and hypothyroidism. Macrocytic anemia classified as megaloblastic macrocytic anemia, non-megaloblastic macrocytic anemia. Megaloblastic anemia due to megaloblastic erythropoiesis or non-megaloblastic anemia due to macronormoblastic erythropoiesis. What are the causes of megaloblastic macrocytic anemia? What are the causes of normoblastic macrocytic anemia? Causes of megaloblastic erythropoiesis are vitamin B12 deficiency, folic acid deficiency, both vitamin B12 and folic acid deficiency. Interference with DNA synthesis may be congenital, may be acquired, hereditary or acquired. Macronormoblastic erythropoiesis due to, these are the common cause, less common cause. Common cause hemolytic anemia and post-hemorrhagic anemia. Less common alcohol intake, leukemia, liver disease, aplastic anemia, cytotoxic drugs, myelodysplastic syndrome, chronic obstructive airway disease, scurvy, hypothyroidism. Anemia due to marrow infiltration or replacement, myelosclerosis, secondary deposit, myeloma, lymphoma. What is megaloblastic anemia? Megaloblastic anemia is characterized by distinctive cytological and functional abnormalities in peripheral blood and bone marrow cells due to impaired DNA synthesis, yielding morphologically large abnormal red cell precursor in bone marrow with ineffective erythropoiesis. The 5 functions of vitamin B12 are synthesis of DNA, the vitamin influences the cell division and blood formation. Energy metabolism, vitamin B12 is vital for energy production in the mitochondria. Lipid metabolism, vitamin B12 is important for the building and maintenance of the cell membrane and myelin sheaths, a protector of the nerves in the central nervous system as well as the brain and spinal cord. Synthesis of hormones and neurotransmitters. The vitamin is needed to produce crucial neurotransmitters and therefore influences mood, psychic and perceptions. Detoxification, homocysteine and cyanides are neutralized by vitamin B12 as well as radicals such as nitric oxide, peroxynitrite, etc. This vitamin is an important opponent to nitrosative stress. These are the 5 functions: synthesis of DNA, energy metabolism, lipid metabolism, synthesis of hormones and neurotransmitters, detoxification. এই যেগুলো তোমার সায়ানাইড অথবা এই যে হোমোসিস্টিন এগুলোকে নিউট্রালাইজ করে, এটার একত্রের নাম বলা হয় এটা। 5 function: DNA synthesis, energy metabolism, lipid metabolism, messenger substances production, detoxification, erythropoiesis. I already mentioned my first class: proerythroblast, basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast. Nucleus ejected in the bone marrow, then form reticulocyte. This reticular network is extracted by mononuclear phagocytic system in the spleen. This is the normal biconcave erythrocytes. এই স্টেজটাই মেনলি সেলগুলো ডিএনএ সিনথেসিসের এই স্টেজটাই ব্লক হয়ে থাকে, যার জন্য এখান থেকে পলিক্রোমাটিক ইরাইথ্রোব্লাস্ট এটা বেশি থাকে বোন ম্যারোর ভিতরে আর কি। হোয়াট ইজ ইনএফেক্টিভ ইরাইথ্রোপোয়েসিস? Ineffective erythropoiesis is defined as a suboptimal production of mature erythrocytes originating from a proliferative pool of immature erythroblasts. It is characterized by accelerated erythroid differentiation, maturation blockage at the polychromatic stage, death of erythroid precursors within the marrow. That is suboptimal production of mature erythrocytes. Ineffective erythropoiesis, the result of ineffective erythropoiesis, anemia, iron overload, abnormal bone marrow microenvironment, hypercoagulability. Anemia lead to poor tissue oxygenation, poor growth. আমরা যে ফিচারগুলো বলেছিলাম অ্যানিমিয়া হলে যা ফিচার হবে সেগুলো হবে। Iron overload, why iron overload occurs in ineffective erythropoiesis? Increased intestinal absorption of iron, side effects of transfusion. Iron overload lead to cardiomyopathy, liver fibrosis, endocrinopathies. Abnormal bone marrow microenvironment, that is bone marrow deformities, hepatosplenomegaly, extramedullary hematopoiesis. Why hypercoagulability stage? Due to hemolyzed thrombogenic RBC. RBC যা ভেঙে যায় ওটা থ্রোম্বোজেনিক। Thrombotic events, pulmonary hypertension. তাহলে এটা যদি আমরা জিজ্ঞাসা করি ইনএফেক্টিভ এরাইথ্রোপোয়েসিস হলে ক্লিনিক্যাল ম্যানিফেস্টেশন কী হবে? অ্যানিমিয়া হবে, আয়রন ওভারলোড হবে, অ্যাবনর্মাল বোন ম্যারো মাইক্রোএনভায়রনমেন্ট হবে অ্যান্ড হাইপারকোয়াগুলেবিলিটি হবে। Megaloblastic macrocytic anemia, non-megaloblastic macrocytic anemia. Megaloblasts are large nucleated red blood cells, precursors with non-condensed chromatin due to impaired DNA synthesis. Macrocytes are enlarged RBC, that is mean corpuscular volume MCV more than 100 femtoliter. Normal কত? 96 femtoliter. Upper limit 96 femtoliter. Macrocyte RBC occur in a variety of clinical circumstances, may be unrelated to megaloblastic differentiation or erythropoiesis. Non-megaloblastic macrocytic anemia. Non-megaloblastic macrocytic anemias are those in which no impairment of DNA synthesis. Included these categories are disorders associated with increased membrane surface area, as in accelerated erythropoiesis, alcoholism, chronic obstructive pulmonary disease. অ্যাক্সিলারেটেড এরাইথ্রোপোয়েসিস কখন হবে? আমরা ওই যে বললাম হেমোলাইজ, ওই কারণ যেগুলো আমরা বলেছিলাম মনে আছে? কমন কজ, লেস কমন কজ, ঠিক আছে? কমন কজ হেমোলাইটিক অ্যানিমিয়া, পোস্ট হেমোরেজিক অ্যানিমিয়া। লেস কমন কজ অ্যালকোহল, লিভার ডিজিজ, হাইপোথাইরয়েডিজম, রেনাল ডিজিজ এটসেট্রা। ম্যাক্রোসাইটোসিস প্যাথোফিজিওলজি। Mechanism producing macrocytosis are not completely understood. The separation between megaloblastic and non-megaloblastic causes is somewhat artificial. History and physical examination, vitamin B12 level, reticulocyte count and peripheral blood smear are helpful in delineating the underlying cause of macrocytosis. Macrocytosis pathophysiology, megaloblastic macrocytic anemia, non-megaloblastic macrocytic anemia. When the peripheral smear indicate megaloblastic anemia demonstrated by macrovalocytes and hypersegmented neutrophil, vitamin B12 or folate deficiency is the most likely cause. Clear? When peripheral smear is non-megaloblastic, the reticulocyte count helps differentiate between drug or alcohol toxicity and hemolysis or hemorrhage or other possible etiologies, that is hypothyroidism, liver disease, primary bone marrow dysplasia, including myelodysplasia and myeloproliferative disorders. It হলো due to reticulocyte count increase due to nuclear maturation lag behind সাইটোপ্লাজমিক ম্যাচুরেশন, এই জন্য সেলটা বড় হয়েছে। আর এখানে আমরা হিসাব করছিলাম কেন বড় হয়েছিল, রেটিকুলোসাইট কাউন্ট বেড়ে গিয়েছিল। কী কারণে বাড়বে, যদি এক্সেস তোমার তৈরি করা লাগে ব্লাড, অথবা এই কারণগুলো। ম্যাকুলোপ্লাস্টিক প্রসেস আর ক্যারেক্টারাইজড অন পেরিফেরাল smear by macrovalocytes and hypersegmented neutrophils which are absent in non-megaloblastic macrocytic anemia. Erythrogenic precursors are larger than the mature red blood cells because folate and vitamin B12 deficiencies result in defective RNA and DNA synthesis. Non-megaloblastic processes have round macrocytes or macro reticulocytes developed from multiple mechanisms and have not been fully outlined. Macrocytosis can occur when there is increased RBC production secondary to peripheral blood cell destruction, hemolysis or blood loss leading to excess reticulocyte formation. Larger cell. Serum elevation in homocysteine and methyl malonic acid result from defective biochemical process in folate and vitamin B12 deficiencies and could be used to clarify the cause of megaloblastic anemia. Nuclear maceration lag behind the cytoplasmic maceration and the slowly divide cells. Ineffective erythropoiesis. Reticulocytes are incompletely processed RBC and therefore are slightly larger than average RBC. Non-megaloblastic macrocytic anemia are those in which no impairment of DNA synthesis occurs. Included this category are disorder associated with increased membrane surface area, accelerated erythropoiesis, alcoholism and chronic obstructive pulmonary disease. What are the causes of megaloblastic anemia? Vitamin B12 deficiency, folic acid deficiency, both vitamin B12 and folic acid deficiency, interference with DNA synthesis by other mechanism, either hereditary or acquired. What is congenital, what is hereditary? What do you mean by congenital or what do you mean by hereditary? Congenital may be hereditary, may be non-hereditary. যেমন পেটেতে বাচ্চা বেরিয়েছে, একটা হাত ভেঙে গেছে, এটা কনজেনিটাল, এটা হেরিডিটারি না, তাই না? আর একটা নর্মাল বাচ্চা বের হয়েছে কিন্তু 10 দিন, 20 বছর, 100 বছর, 50 বছর পরে যে তার সমস্যা হয়েছে, এটা একটা হেরিডিটারি। অথবা হেরিডিটারিলি জন্ম থেকেই হেরিডিটারি কোনো ডিফেক্ট নিয়ে আসতে পারে। কনজেনিটাল মানে বর্ন উইথ, যদি খারাপ অবস্থায় বাচ্চা জন্মগ্রহণ করে সেটা হচ্ছে কনজেনিটাল, আর হেরিডিটারি হচ্ছে যদি তার জিন ডিফেক্টের কারণে কোনো অসুবিধা হয় সেটা আর কি। Daily requirement 2 microgram according to the USA Institute, 1.5 microgram according to the UK National Health Service, 2.4 microgram daily use, 2.4 microgram according to the USA Institute of Medicine, 1.5 microgram according to the UK National Health Services. Increased requirements যদি হয় তখন কী হবে, 5 microgram. When requirement is increased, factors which increase and individuals vitamin B12 requirements are chronic illness, stress, toxic stress, pregnancy and breastfeeding.